Dr. Beale, I remember one day our Jack Russell Terrier met our chinchilla and the tail was gone. I rushed up to our veterinarian and the veterinarian said, no, I don't do that. You're going to have to go to a specialist. I ended up here. Explain the difference between what you all do and regular vets do.
So Gulf Coast Veterinary Specialist is an organization with a number of specialists that are trained more specifically in individual fields. So much like you might go to your cardiologist if your primary care physician diagnosed a heart problem, the same thing happens here. So typically, if it's something that your veterinarian feels is out of their area of expertise, they might refer you to a specialist in this hospital who deals only with that area of the body.
Yeah. You also deal with different treatments that go beyond the average. For example, you may have an animal where they're going to have 3 legs.
Right. So we have veterinarians that work in kind of the equivalent of physical therapy. We have veterinarians that do chemotherapy that your primary care veterinarian may not be comfortable doing. We also have a number of diagnostics that are available to us that your veterinarian might not have, such as an MRI or a CT scan. So we have a higher level of care that might be available should it be needed for pets.
Yeah. Snow here is like, look, I'm being left out, and I really need to get into the shot as well. Hello, Snow. With that said, we've come so much further. Obviously, in medicine, whether it's animals or humans, technology has changed a lot. Other things have changed as well. For example, getting pet insurance, because we know now today we want to keep our pets with us much longer. There are things that can help us keep them with us longer, and healthcare cost.
Yes, absolutely. I strongly recommend that all clients and pet owners get insurance for their pets, preferably when their dogs or cats or iguanas or whatever they might have are young, because most pet insurance, just like many human insurances, have exclusion policies on pre-existing conditions. So if your dog has any history of skin disease or ear disease and you get insurance 3 years down the road, that's not going to ever be covered. So the nice thing about getting it when they're puppies is that you'll have everything included in the coverage.
Just like with humans, I would imagine when you can cut that time and get to a specialist quicker, the outcome is oftentimes much better.
I think that's true in many cases, and I think that we have a good relationship with veterinarians in this city, and they're very good about sending us patients when they feel like they can no longer provide care or that patient needs a level of care that they're not able to provide.
Yeah. And as we mentioned, you can handle just about anything. I think I said earlier, furry, fluffy, feathery, scaly, or slithery. Did I leave anything out?
I think you got it covered.
All right. So, Snow, clearly you prefer her over me, so I'm going to leave you here, and we're going to go check out some other parts of this hospital. All right? Bye.